Senator Miller.
Thank you, Mr. President. I move that further proceedings under the roll call be dispensed with and the Sergeant at Arms be instructed to bring in the absent members.
To that motion, all those in favor signify by saying aye. Aye. Those opposed, motion does prevail. The Secretary will close the roll. Members, please stand for the prayer. Today's chaplain is the Reverend Dr. Joy McDonald Covet of Christ Lutheran on Capitol Hill in St. Paul. And following the prayer, please remain standing for the Pledge of Allegiance.
It's so good to be with you. This prayer today is inspired by the poem Passover Remembered by Alla Bozarth Campbell and prayers from Evangelical Lutheran Worship. Let us pray. We are in a complicated season of life and work. Is this a wilderness time or spring or both? There are many tasks to be accomplished in each day's work, and there are unexpected challenges, interruptions, complications. We wonder if we really have what we need to navigate through the day, let alone the season. God, you come among us inviting, pack nothing. Bring only your determination to serve and your willingness to be free. Don't wait. Be ready to move. Do not hesitate to leave these old ways behind: fear, silence, submission. Only surrender to the need of the time, to act justly, to love mercy, to walk humbly. Set out in the dark, I will send fire to warm and encourage you. I will be with you. You will learn. I will give you dreams and guidance. The stories you tell each other will make you strong and wise. I am sending you today to make a new way and to learn my ways more deeply. Continue to call each other by the names I've given you, beloved ones, to help remember who you are. You will get where you are going by remembering who you are. Remain true to this mystery. Pass on the whole story. Do not go back. I am with you now, and I am waiting for you. Oh God, direct us in this season in the important work of today and extend to us your continual help. We commit and commend ourselves to you, in whom we live and have our being. Be the goal of our work and our rest along the way. Let our hearts, so often restless and wondering, find peace and understanding through you. Amen.
The Secretary will take the roll.
Senators Abler, Anderson, Bach, Benson, Bigham, Carlson, Chamberlain, Champion, Clausen, Coleman, Swazinski, Dames, Dibble, Dornick, Draheim, Duckworth, Dietzig, Eaton, Eichhorn, Eakin, Fate, Friends, Gazelka, Goggin, Herr, Hoffman, Housley, Howe, Ingebritsen, Isaacson, Jasinski, Johnson, Johnson, Stewart, Kent, Kiffmeyer, Klein, Cran, Kunish, Lang, Latz, Limmer, Marty, Matthews, McEwen, Miller, Murphy, Nelson, Newman, Newton, Osmic, Pappas, Port, Pratt, Putnam, Rarick, Rest, Rosen, Rude, Senjum, Tomasoni, Torres, Ray, Utke, Weber, Westrom, Uyghur, Wickland.
Pursuant to Rule 14.1, the following members intend to vote under Rule 40.7. Senators Draheim, Fateh, Lang, and Tomasoni. A quorum is present. Starting with the second order of business, executive and official communications, the following communication was received. Please note no action is required. Moving to the third order of business, messages from the House. The Secretary will read the message.
Mr. President, I have the honor to announce the passage by the House of the following House files herewith transmitted. House file numbers 2875, 3175, and 3035. Patrick D. Murphy, Chief Clerk, House of Representatives.
No action is required. We move to the fourth order of business, first reading of House bills. The House bills have been given their first reading and referred as indicated. Moving to the fifth order of business, reports of committee. Senator Miller.
Thank you, Mr. President. I move that the committee reports printed in the agenda be adopted.
All those in favor of the motion signify by saying aye. Aye. Those opposed, the motion does prevail. Moving to the sixth order of business, second reading of Senate files. The Secretary will read the Senate file numbers.
Senate file numbers 2854, 1252, 2635, 3409, 3585, and 2676.
The Senate files are given their second reading. Moving to the eighth order of business, introduction and first reading of Senate bills. The bills listed in today's introduction calendar are given their first reading and referred to as indicated with the following exceptions. Page 2. Senate File 3738 is referred to the Committee on Environment and Natural Resources Finance. Page 3. Senate File 3750 is referred to the Committee on Environment and Natural Resources Finance. And on page 6, Senate File 3785 is referred to the Committee on Judiciary and Public Safety, Finance, and Policy. Moving to the ninth order of business, motions and resolutions. We will adopt the author's motions in one motion. All those in favor signify by saying aye. Those opposed, the motion does prevail. Remaining under motions and resolutions, Senator Miller.
Thank you, Mr. President. Pursuant to Rule 26, I designate the following bills made special orders for immediate consideration. Members, the list is on your desk.
First bill on the agenda is House File 2454, number 2 on general orders. Senator Rarick.
Thank you, Mr. President, members. House File 2454 is a request from the City of Mora. They currently have a Public Utilities Commission with 3 members, and they are requesting to go to 5. We had Mayor Skramstad and PUC Chair Ardner both appear asking for this. They've had some members who have had some illnesses or had some struggles to get a quorum. And then members also would like to be able to discuss some issues together in preparation for meetings. So they're requesting the permission to go to a 5-member board to give them that flexibility. They do have people recruited already. They will be appointed by the City Council, so they would appreciate your support.
Discussion to the bill. Seeing none, the Secretary will give the bill its third reading.
House file number 2454, a bill for an act relating to local government.
Third reading. Any further discussion? Seeing none, the Secretary will take the roll on House File 2454. Senator Jasinski.
Senator Jasinski votes aye.
Jasinski votes aye. I call on Senator Friends to report senators voting under Rule 40.7. Senator Friends.
Well, thank you, Mr. President. I report Senator Fateh votes aye.
Fateh votes aye. Senator Friends.
Senator Isaacson votes aye.
Isaacson votes aye. Call on Senator Johnson to report members voting under Rule 40.7. Senator Johnson.
Thank you, Mr. President. Senator Lang votes aye.
Lang votes aye. Senator Johnson.
Senator Tomasoni votes aye.
Tomasoni votes aye. Senator Johnson.
Senator Draheim votes aye.
Draheim votes aye. All members having voted with the desire to vote, the Secretary will close the roll. There being 65 ayes and no nays, House File 2454 does pass as title agreed to. Next bill on the agenda is House File 2841, number 11 on general orders. Senator Johnson.
Thank you, Mr. President. I'd like to present 2638 here, or 2841, I'm sorry, this morning. This has all the glamour of the Revisor's Correction Bill with the general appeal of Senator Rarick's board bill that we just did. This is a technical bill that updates the property registration laws in Minnesota. The bill itself was developed by the Real Property Section of the Minnesota State Bar Association. It really just codifies current practices within the title examiner's offices. Overall, this would help with citizens and just ease the process in court going forward. It had a thorough vetting in Civil Law Committee, and there was no opposition. With that, Mr. President, I encourage a green vote.
Discussion of the bill. Any amendments? Seeing none, the Secretary will give the bill its third reading.
House File Number 2841, a bill for an act relating to real property.
Third reading. Any further discussion? Seeing none, the Secretary will take the roll on its House File 2841.
Mr. President,
Senator Jasinski.
Senator Jasinski votes aye.
Jasinski votes aye. I call on Senator Utke to report members voting under Rule 40.7. Senator Utke.
Thank you, Mr. President. Senator Lang votes aye.
Lang votes aye. Senator Utke.
Senator Tomasoni votes aye.
Tomasoni votes aye. Senator Utke.
Senator Draheim votes aye.
Draheim votes aye. I call on Senator Friends to report members voting under Rule 40.7. Senator Friends.
Well, thank you, Mr. President. Senator Fateh votes aye.
Fateh votes aye. Senator Friends.
Senator Isaacson votes aye.
Isaacson votes aye. Senator Johnson, would you like to vote on your own bill? All members having voted The secretary will close the roll. There being 67 ayes and no nays, House File 2841 does pass its title agreed to. Next bill on the special orders is Senate File 2302, number 33 on general orders. Senator Nelson.
Thank you, Mr. President. Senate File 2302 is a bipartisan bill. It's called the Nurse Licensure Compact. The Nurse Licensure Compact would allow nurses to obtain a single license to work in multiple states. The license reflects the same high standards and safety of current state licensure, but it does provide a modern system that supports nurses and their patients in giving and receiving the best care possible. Before I continue, Mr. President, I would like to thank the co-sponsors on this bill, Senator Eakin, Senator Benson, Senator Johnson, and Senator Rosen. Most importantly, members, it's important to know that Minnesota nurses want the Nurse Licensure Compact. In 2022, the Minnesota Board of Nursing survey found that nearly 80% members of Minnesota nurses supported joining the compact. I will tell you why. While at the same time, fewer than 10% opposed. So that means that Minnesota nurses support joining the contract by a ratio of about 10 to 1. Now, Minnesota needs the Nurse Licensure Compact. We know that healthcare is changing. We have seen it even change quicker during the pandemic. Patients are mobile. Patients do not live and stay and get their health care within state lines. And we know that nurses increasingly provide care through telehealth, and they should not be limited by state lines either. The Nurse Licensure Compact makes sense. Now, Minnesota has joined other compacts to allow professionals to practice across state lines. Why would we deny nurses the same opportunity? The compact does have the support of nurses. We heard about the support of the military. We know that it is proven, it is safe. It is important that we allow our Minnesota nurses to remain competitive with their peers. It is important that we allow Minnesota to participate in the Nurse Licensure Compact, which 39 other states and jurisdictions have done so. Now, you might hear a few arguments against the Nurse Licensure Compact. We do usually hear arguments respectfully on this floor, members. But you should know that the Minnesota Nurse Licensure Compact is safe. You will hear that it's unfair, and yet Minnesota nurses, patients, providers, military want this compact. In fact, on your desks, you will see a coalition of 59 supporters who agree Minnesota must join the Nurse Licensure Compact. In fact, you might even hear a parade of horribles about what will happen if Minnesota does join the Nurse Licensure Compact. Well, members, 39 other states have implemented, and jurisdictions have implemented the compact with no problems. The compact has been implemented for 20 years with no problems. And as I said, Minnesota has already joined several other states, other compacts that allow, in this case, physicians to practice across state lines. Why would we restrict our nurses? The arguments are baseless, quite frankly. They're distractions from the safety issue. The safety issue is a non-issue. You can see the most recent Board of Nursing article, which does show that nurses with a multi-state license have half of the disciplinary actions as single licensure nurses. So Senate File 2302 will help patients with keep current high quality care. They should be able to count on that. The standards of the Nurse Licensure Compact ensure nurses are highly trained, of course, with FBI background checks. The Nurse Licensure Compact will directly address the healthcare workforce crisis that we are seeing in Minnesota. It is a crisis. You can refer to the deed estimates in our own state right here, 40,000 healthcare workers short. And finally, Senate File 2302 increases the number of available medical nurses for medical providers so that they can provide the highest quality care for patients across the state. It is time to act, members. The nurse licensure is safe. Every nurse must pass the national nurse licensure exam. Again, why would we not allow Minnesota nurses to join nurses from 39 other states and jurisdictions that have the opportunity for one multi-state license, instead of requiring our Minnesota nurses to get licenses in multiple states? I'm sure we'll have much more discussion. I think it should be an easy green vote. I would stand for questions, Mr. President.
Discussion and amendments for Senate File 2302, Senator Murphy.
Thank you, Mr. President, and thank you, members. I am a registered nurse, as you know. I just renewed my license about a week ago. It took me about a half an hour and cost $85. I needed to complete 24 hours worth of contact hours, so renewing my education to make sure that I am current and up to date, which I did, proudly so. I also am a faculty member at the University of St. Catharines. I teach in the Doctoral of Nursing Practice program. And in 2017, I was inducted into the Academy of Nursing, which is a rare honor for me, an international organization of nurse leaders across the globe. Nursing is something I know a fair amount about. It is my area of professional practice, and I stand today in opposition to the Nurse Licensure Compact. Just a couple of baseline pieces of information. Bear with me, Mr. President. The nurses in Minnesota over a century ago came together to say that we need to make sure that there are high standards and high expectations for the nurses in Minnesota. We are going to organize ourselves to create a Nursing Practice Act. We're going to fight for licensure for professional nurses in the state of Minnesota. And we're going to make sure that the people that are practicing nursing in the state of Minnesota are registered. That is why today I am a registered, licensed, professional registered nurse. Because I am registered and licensed with the Board of Nursing knows that I am meeting the criteria, those standards that we have set for ourselves, and they know that I am here practicing in Minnesota. If we enter the compact, those nurses who would come from other places under the multi-state licensure would no longer be registered. We wouldn't know who is practicing here in the state of Minnesota. From a professional perspective, I have a big problem with that. When I went to school, I got a baccalaureate degree in nursing, and then I took my licensure exam. Senator Nelson referred to that standardized licensure exam. It's called the NCLEX. We all have to take it, whether we study at a 2-year degree or 4-year degree. But to enter the practice of nursing, to get that first license, we have to take that standardized test. It is a floor for our practice. Registered nurses continue to go on to education. They will get a baccalaureate degree in some cases, a master's degree, a terminal degree, the Doctor of Nursing Practice, a clinical doctoral degree. Nurses get certifications, and every 2 years we have to complete 24 hours more of continuing education. Those are the standards that we have set for the nurses in the state of Minnesota. Those are not the standards that are set in other states. Those are not the standards set in other states. So when I say by entering into the compact that we are eroding the high standards and the high expectations that we have set in the state of Minnesota in state law, that have been a part of our regulatory frame for more than 100 years here in the state of Minnesota, that is why. From my perspective, the nursing compact will weaken the high expectations and high standards we have for professional nurses and professional nursing in the state of Minnesota. It will therefore weaken or threaten to weaken patient care inside our hospitals because the nurses practicing are no longer required to meet our high standards and our high expectations. They will only meet the floor of that original standardized test you have to take when you're first done with school. And last but not least, and probably most importantly, as we are now recognizing the entry into the third year of this pandemic that has really played and wreaked havoc on the practice of nursing across this country, this compact will not solve the crisis inside our facilities. If you look at the research at nursing and where nurses are, Minnesota enjoys one of the highest number of registered nurses, of licensed nurses per capita of any state in the nation. We have more nurses per Minnesotans here in the state. We have more registered nurses now licensed in the state of Minnesota than we did before the pandemic, than we did 5 years ago. The problem that we're facing is not the number of nurses. The problem is those nurses are stepping away from professional practice in our hospitals. Entering the compact will not solve that problem. We will not have more nurses necessarily coming to Minnesota. The regulatory framework that we have here in Minnesota already works. It has worked for more than 100 years. It is easy to get a license once you've passed the NCLEX. And once you're licensed in one state, it is easy as a matter of a computer application in a few days. You pay a fee and you're in. Licensure, state by state, has always been the state's purview. It is how we guarantee our high standards and our high expectations here in the state of Minnesota. I think it is important to mention, and Senator Nelson has brought this up both in hearings and here today on the floor, that 80% of registered nurses or licensed nurses support this. That is a false number. Senator Nelson is referring to a survey conducted by the Board of Nursing when you reapply for your license. There are 138,000 licensed nurses in the state of Minnesota. 20,000 or so nurses completed that survey. 80% of that 20,000 say they like this idea. That's about 13% of the nurses in the state of Minnesota. That is not a majority. That is far from a majority. We together as policymakers have set the regulatory frame for nursing to guarantee our high standards, our high expectations for patient care inside our hospitals. We should be listening to our professional nurses first and foremost. They are saying we need to change the way staffing is happening in hospitals. They are asking for more mental health support. They're asking that we reduce violence inside our healthcare facilities. They want to make sure there are adequate faculty and loan forgiveness. Those are the things we need to do to make sure that we are retaining our nurses in practice, those nurses who are leaving practice to come back in. The compact won't solve that. It is a Band-Aid at best, but it doesn't solve our fundamental problem. By engaging in this policy, we are undermining our high expectations and our high standards for the practice of nursing. We are undercutting the practice of nursing, making it less safe for patients, and we are not solving the fundamental problem for the practice of nursing, and that is why we need to vote no on this policy today. It is not up to Minnesota. Thank you, Mr. President.
Senator Wickland.
Thank you, Mr. President. Yes, I'd like to rise to express my concerns about the bill that's before us today. We know that Minnesota nurses provide some of the highest quality care in the country here in Minnesota. And we also know that the pandemic placed enormous stresses on our nursing workforce. And they bore the burden of many, many days and days of service, and we are thankful that they have been there to support and to take care of our fellow Minnesotans. This bill, I do not think, is the solution that we need at this time. What we need at this time is to look at other bills that are introduced in the Senate, which would address the concerns that the nurses are bringing forward to us. We have bills that would work on addressing the conditions that nurses are facing in hospitals today. These bills would address the need for long-term supports around mental health. They would address the needs for better staffing. That is one of the things that I have heard from nurses in my own district repeatedly, is what great deal of pressure they are facing when they go in for a shift at work. They're sometimes working extended hours, extended shifts, and not by their own choice. They would like to be fulfilling their duties as a bedside nurse in a way that assures patient safety, but they're being placed in conditions where they can't provide the best care. And so this bill today does not address those issues, but we do have solutions available to us that could address them. We know that we have more nurses working in Minnesota. We should be asking, why are we facing a shortage of nurses to staff our hospitals when we do have a greater number of nurses working in Minnesota, or registered in Minnesota? We should be asking, how do we address these conditions now? And I don't think the nursing compact is the way to put more than a Band-Aid on this current situation. Thank you.
Senator Bigham.
Thank you, Mr. President. As I'm reading through this, I'm looking at lines 1.19 that talks about coordinated licensure information system. And I am reading from the bill, Mr. President, just to clarify for the viewers at home, in accordance to our Senate rules. It talks about lines .119 means integrated process for collecting, storing, and sharing information on nurse licensures and enforcement activities related to the nurse licensure laws. And then if I go to line 8.6, Mr. President, it talks about, notwithstanding any other provision of law, all party state licensing boards contributing information to the coordinated licensure information system may designate information that shall not be shared with a non-party, and continues. And then I look at lines 1.16, and it talks about some of the powers, Mr. President, that this compact would have, such as to promulgate uniform rules to facilitate and coordinate implementation and administration of the compact. Then the next one, to bring and prosecute legal proceedings or actions in the name of the commission. I continue to read. We go to lines 12.23, talks about the commission being able to levy and collect an annual assessment from each party to cover the costs of its operations. Again, this is on the compact. And then I go to lines 13.24. It talks about that the commission shall indemnify and hold harmless any administrator, and it goes on to list the folks in the compact. And then Article 7 talks about rulemaking. Now, I remember, I'm old enough to remember the SIPAC discussion we had last session, Mr. President, and I know that Senator Benson brought that through civil law and judiciary and did a fine job on it. We had a great, thorough discussion on it, fixed it, sent it out, and it is current law. So I'm wondering if Senator Matthews would yield for a question.
You're asking for, Senator Bingham, you're asking for Senator Matthews?
Yes.
Senator Matthews is not in the chamber.
Okay. Would Senator Nelson then yield?
Senator Nelson will yield. Senator Bingham.
Thank you. Senator Nelson, I serve on the Civil Law and Data Practices Policy Committee, and this did not come through the committee this session prior to this vote. Am I correct on that?
Senator Nelson.
Thank you, Mr. President and Senator Bingham. There was no request for the bill to go to civil law. I would reiterate that the questions that Senator Bingham are bringing from the bill, that these are standard with the 39 other jurisdictions that are part of the compact that have had no no problems. And so I just want to address those concerns briefly, that they have not historically been any issues at all. But no, directly to your question, Senator Bingham, there was not a request to send the bill to civil law.
Senator Bingham.
Thank you, Mr. President. I will refrain from asking the Chair of State Government Finance if this bill had gone through state government, being that it talks about rulemaking. I will save the body time. I understand that this is in many states, this nurses compact, but so is the SIPAC, and we had a process there so that members of this body in Minnesota could deliberate and discuss that. So if there hasn't been a request, I will make it now. And Mr. President, I move that Senate file number 2302 be re-referred to the Committee on Civil Law and Data Practices Policy.
Just one moment. I want to check rules on this.
Mr. President, I'll request a roll call.
We're checking to make sure that the motion is in order. Roll call request, excuse me, roll call has been requested, roll call is granted. On the motion to re-refer, Senator Bingham.
Thank you, Mr. President. I've laid out in the matter throughout the whole bill where it talks about data practices, issues that should be in front of the Civil Law Committee, and also rulemaking that should have gone through the State Government Finance. So I would appreciate folks supporting this motion, please.
Further discussion of the motion to re-refer. Senator Latz.
Mr. President, thank you. I rise in support of the motion to re-refer this bill to the Civil Law Committee. You know, when I chaired the Judiciary Committee, it was a combined committee. It included civil law jurisdiction. And I continue to serve on the Civil Law Committee now that the jurisdiction was split into two separate committees. And it's on those committees, in particular the Civil Law Committee, where the members who have the most experience in this body on issues relating to civil law serve. Senator Limmer, who chaired a combined committee and then chairs now the Judiciary and Public Safety Committee, also serves on the Civil Law Committee. And he is the co-chair of the Joint Legislative Commission on Data Practices. There's a reason, it's actually a pretty arcane and detailed and complicated law that we have here relating to data practices, but it basically lays out the criteria for what government-held data is considered to be not public in some way. And we've seen it come up in a whole cross-section of policy areas in the statute, including body cameras and all sorts of things. Chapter 13 is pretty extensive. But there's a reason why bills that involve or have an impact on data practices go through civil law. It's because that's where the experts are, in this Senate on that topic. And to skip that step, we can sit here right now and we can say, well, we don't think there are any issues. But we don't really know. I mean, I haven't seen the bill. I haven't seen the Minnesota Coalition on Government Information, MINCOGI. I haven't seen them come in to Civil Law Committee to testify about this. We haven't had law professors, which we have sometimes, come in and testify about data practices issues. We haven't had Don Gemberling, who is a retired data practices expert in the state of Minnesota when he worked for the Department of Human Services. He sometimes comes in and testifies, and he educates the committee and may raise issues that none of us here today are even thinking about. Without that committee hearing, however, we won't have that opportunity to do that. Also, questions relating to venue or jurisdiction in the case of any disputes that arise under this, and this is pretty important. I recall that in SIPAC, for example, disputes for jurisdiction were venued in Atlanta, which is the headquarters for that interstate compact, which would make it awfully difficult for Minnesotan to bring a meaningful challenge without incurring the added expense of having representation handle the case in Atlanta. Rulemaking is all fine and dandy when you don't object to the rule that has the force and effect of law. It's in effect like a statute once it goes through the rulemaking process and is adopted. But if you have an objection to it, or if you want to shape what happens, or if you want to set in statute some guidance as to guardrails, for example, as to what is and is not allowed in the rulemaking process, that's the role of the Senate or the legislature in approving or disapproving rulemaking provisions in bills. And the fact that this bill hasn't gone through Government Operations Committee, which has jurisdiction over rulemaking, is also a pretty significant flaw. And there are a lot of people who serve on that committee that have that level of expertise and knowledge and background to raise those kinds of questions. When I served in the Attorney General's office, I did some rulemaking work. Now, this was a long time ago, but I got a sense of how complicated the process can be and how detailed those rules are, because we don't have the time or the expertise within the legislature to come up with every detailed aspect of what the rules will be, what the criteria will be governing any particular program that we have delegated to a state agency to operate, and sometimes not just to operate, but to create, or to flesh out, or to give proper guidance to and notice to all the participants in the state. One example of that is the Ignition Interlock program, which needed the detailed expertise and the work gathering input from many, many stakeholders before they could even come up with the criteria that should go into a rule, let alone go through the process and formal adoption of those rules, which, as I say, are just like statutes once they're adopted in terms of their impact and control over behavior of Minnesota residents. So there's a reason why we have a process here in the Senate. And all of you who serve on committees understand sometimes it's like being in school. You sit on the committee and the experts in that area, they come in and they testify. They educate the senators in a way that no one senator can have the level of knowledge. That's why we have the committee process, and they raise questions and we get to think about them and ask other questions and so on. It's a deliberative process. When a bill comes to the Senate floor, we may not even know the questions to ask, let alone what the right answers would be if we could ask them. That's why we have committees. And so failure to follow that process, in the end, deprives the residents, the citizens of Minnesota, those subject to the laws of Minnesota, of the opportunity to be heard, because we don't allow public testimony here on the Senate floor. It also deprives them of the opportunity to have a bill that has been thoroughly and properly vetted by the legislature before it becomes law. That's not a good process. And I'm a little bit perplexed as to why The chief author of the bill said that in the 39 other states where this compact has been adopted, they haven't had any issues. I mean, I'd like to see the document, the background, the study or the research that has gone to every 39 states and identified what issues, if any, have been raised about any of the issues that we're discussing here today, including the ones that haven't gone through committee. And I'd be shocked if there wasn't some dispute in one of those states somewhere over the many years over the provisions of the compact. So I really think that it's incumbent upon the chairs of a committee to be a little bit jealous about their jurisdiction, to assert the jurisdiction of the committee over significant provisions that are in a bill that are covered by their committee's responsibilities. Failure to do so not only deprives the bill of legitimacy if and when it becomes law, not only deprives the public of the opportunity to participate in the process, but it erodes the significance of the jurisdiction of that committee. Legislators who introduce bills or are trying to get bills passed who know that they might be able to bypass a committee just because they want to have a cleaner, more direct route to the floor, also know that they aren't going to be held to the standard of proving their case to a majority of the members of a committee, that a bill ought to become law in the language that it appears before us today, which is what we're voting on. We're voting for or against a proposal to become statute. And it's very hard to change a statute. So in the committees that I serve on, for the most part, we try, I'll back up. When I was chair, I tried to make sure that a bill was ready to become law before it left the Judiciary Committee. Now, that doesn't mean it's not going to be changed along the way. That's part of this process. But we wanted to make sure every I was dotted, every T was crossed, every word in there said what it was that we as a committee intended it to say as if it were going to become law. And if we don't go through that process, if the chairs don't insist that bills that have relevant provisions come through their committee, it degrades the process and it degrades the jurisdiction of that committee. So, members, I think all of you who are chairs right now ought to be voting for this motion to re-refer it to the Civil Law Committee. Because if you don't, it will be a signal to all of us that you are willing to abdicate the responsibilities of your committee when significant provisions are in a bill and let it come straight to the floor. Now, there may be times when there's something that's completely terribly minor or inconsequential, and all chairs kind of decide stuff that's sort of on the borderline. Do we need to see it? Don't we need to see it? But here we've got multiple provisions within the jurisdiction of civil law. I don't see that it makes any sense to give it a complete pass on the committee's jurisdiction, and I think every chair ought to be concerned about setting that precedent as well. So I'd encourage members to vote green on this motion. Thank you.
To the motion to re-refer, Senator Nelson.
Thank you, Mr. President. I do appreciate getting back on the question before the body. I would encourage the President to review Section 101 of Masons regarding the debate must be confined to the question before the body. The preceding member from Senate District 46 kind of wavered around that question, but finally got back to it. Mr. President, I will stick to Masons, to the question before the body, and I will save my other comments until a later date. But to the question before the body, should in fact this be re-referred? To the comments just heard, I do want to make sure members know that the regulations being concerned with, the rulemaking being concerned with in the debate preceding this is of a federal nature, members. It is federal regulation, which we do not regulate in the state of Minnesota. Furthermore, I want to assure the members and the public that the bill has gone through the committees to this bill: Health and Human Services, Finance and Reform, and the Finance Committee. And to reiterate, the regulation being discussed is not a jurisdiction of the state of Minnesota. It is a jurisdiction of the federal government. I would encourage a green vote so that we can continue to discuss why Senate File 2302 will benefit nurses, patients.
So, Senator Nelson, just a commentary on Senator Latz's discussion. I felt that he brought it back. He was using, in the middle of his discussion, to build the points towards the motion to re-refer. I didn't necessarily think that he was too far away from being on point. Therefore, I read through Section 101. I appreciate your thought on it, but I think that Senator Latz was within order and to the motion to re-refer. That's why I made sure we came back to the motion to re-refer, not to the merits of the actual bill itself. First up, the first person who stood up was Senator Bingham.
Mr. President,
for what purpose does Senator Benson rise?
A point of clarification. Senator Nelson advocated for a green vote. Could you explain to the body what a green vote on this motion would mean and what a red vote on this motion would mean?
Yes, Senator Benson, that was going to be right as we got to the actual vote. A green vote would be to re-refer this bill to the Committee on Civil Law and Data Practices Policy. A red vote would be to return back to where we were, which is second reading. So I will reiterate that when we come back to wherever we're going to go. Senator, to that point, Senator Nelson?
Absolutely. Yes. My request is for a red vote so that we can keep the bill on the Senate floor and fully debate its merits. Thank you for the clarification.
Yes. Senator Bingham.
Mr. President, to the motion at hand, the reason that you should be voting green to send this back to the Civil Law and Data Practices Policy Committee is because the SIPAC also was federal law, and that went through both jurisdictions with no issues. So just wanted to point that out for clarification.
To the motion to re-refer, Senator Matthews.
Thank you, Mr. President. I didn't come prepared to speak on the debate today, but getting called into it here, I double-checked with our Senate counsel and confirmed where we were at along with it. Because this bill is not impacting Minnesota data privacy law, we left it at the chair's discretion on this matter. This is different from not all compacts have differing areas on this. So because this is not changing underlying Minnesota data privacy law, if data is allowed to be shared under Minnesota state law, it can be shared in the compact. If it's not allowed to be shared under Minnesota law, then it's not shared in the compact. So that was why we opted not to hear it in the Civil Law Committee, and I've double-checked that with our Senate counsel. So I would support Senator Nelson's position of voting red on this motion, Mr. President.
Senator Murphy?
Thank you, Mr. President. Members, I do rise in favor, in support of sending this to Civil Law. And just for a point of clarification, in Minnesota, the practice of nursing is regulated by the Board of Nursing, which is a public entity. They implement the laws that we set here to make sure that we're meeting our high standards and our high expectations. The compact is the work of an association of state boards, the National Council of State Boards of Nursing. It is a nonprofit, non-governmental organization. So we would be, in essence, turning the practice of nursing, the regulation of nursing, now under the regulation of us, to not a federal agency, but a national association of state boards of nursing. They're not required to have public meetings. They're not open to sunlight. They are not a federal agency, but instead an organization of state boards of nursing, a nonprofit. We would be turning the regulation of nursing by entering into a compact that we can't alter. You know, we're not making an amendment to this bill today on the floor because we cannot alter the compact. It disallows it. It says you are bound to what we say. We, the legislature, now bound to what is said by an association, a nonprofit, a non-governmental organization that doesn't even abide by sunlight laws. I think that this should go to civil law for a full examination, including the database nurses that is at the backside of the compact, to make sure that the data that we consider private here in Minnesota is private in that database. That is not assured yet. That should be examined in the Civil Law Committee, and that's why we should vote yes to move this to civil law.
Members, seeing no further discussion, again, to reiterate the motion on the floor is to move that Senate File 2302 be re-referred to the Committee on Civil Law and Data Practices Policy. A green vote will re-refer back to committee and take it from the floor. A red vote will remain on the floor, and we will continue with second reading. The Secretary will take the roll. Senator Jasinski.
Senator Jasinski votes no.
Jasinski votes no. I call on Senator Friends to report members voting under Rule 40.7. Senator Friends.
Thank you, Mr. President. Senator Fateh votes aye.
Fateh votes aye. Senator Friends.
Senator Isaacson votes aye.
Isaacson votes aye. Call on Senator Johnson to report members voting under Rule 40.7. Senator Johnson.
Thank you, Mr. President. Senator Lang votes no.
Lang votes no. Senator Johnson.
Senator Tomassoni votes no.
Tomassoni votes no. Senator Johnson.
Senator Draheim votes no.
Senator Draheim votes no. Senator Johnson, will you kick Senator Limmer for us? The Secretary will close the roll. There being 31 ayes and 36 nays, the motion does not prevail. We return to second reading of Senate File 2302. On the list is Senator Eaton.
Thank you, Mr. President. I am a registered nurse in the state of Minnesota. I've been a member of the Minnesota Nurses Association for 25 years. And I want to tell you that nursing is a calling. Many of us went into it emotionally as well as intellectually. It is that you go there and you're really into making someone feel better. You're into helping a patient. You want to use your practice that you're very proud of. You want to follow what you've learned to help improve someone's mental or physical health. And when you get there and you find out that you have so many patients and with so many needs that you can't do what you're taught, It's demoralizing. It breaks your heart. And after a while, it really wears you down. Many nurses were feeling that before the pandemic, and the pandemic just increased it. When, nurses take pride in stepping up when there's an emergency or when things are tough. They take pride of going the extra mile and being able to handle the emergency situation or the difficult, complex patient. But when that becomes an expectation day after day after day, it gets to be too much. There's no longer that excitement to go in there and really make a difference in someone's health, in their life. All you're doing is going there and being a pill pusher or, a lot of times you get to where you don't even have time to do the basic assessments. You have some nurse's aide doing it and reporting to you if their assessment is hopefully as qualified as yours. And then there's somebody who is supposed to be turned a number of times during the shift, and you only have time to do it a couple of them. And so you got that guilt going on, and it just eats away at you. There's a reason nurses are leaving the bedside. This has been so hard, and I love nursing, and I'm leaving the Senate, and this is my last year, and I renewed my license just in February with the thought that I may want to go back. I'm not so sure now. I'm not sure. This bill does nothing to address why nurses are walking away from the bedside. It just makes it easier for hospitals to replace them and not to deal with the reasons they're leaving. It's a slap in the face to bedside nurses, and I urge you to vote no.
Seeing no further discussion, the Secretary will give the bill its third reading.
Senate File Number 2302, a bill for an act relating to health occupations, creating a nurse licensure compact.
Third reading. Further discussion. Senator Marty.
Thank you, Mr. President, and thank you, members. This interstate nurse staffing compact, I don't think it's a solution. I don't think, as some said, it's even a partial solution. If anything, I think it makes our healthcare system less safe. And I want to start by saying I think there's no disagreement that there are shortages of nurses staffing our hospitals. If you talk to the nurses who work in the hospitals, exactly what Senator Eaton is saying. They were struggling with shortages before COVID, and COVID's made it worse. Talk to the nurses how stressed out they are, how they're concerned about whether the patients are getting the time they need, the care they need. Let's be clear, there is a shortage of nurses in Minnesota hospitals. In our hospitals, there is a shortage. But that's not because there's a shortage of nurses in Minnesota. It's not something this compact is going to address. This compact would not address the shortage of Minnesota nurses because there isn't a shortage of Minnesota nurses. It's a decision by hospital systems and the corporate leaders that's leading to the short staffing we've got. Minnesota has, and I think it's the SEIU letter that Senator Wickland handed out, points out there are 16 nurses in Minnesota per 1,000 residents. That's 30% more than the 12 in other states on the average. We are 30% better equipped to meet our nursing needs than other states, 30% better. Minnesota does not have a shortage of nurses. What we have is a shortage of nurses in the hospitals because the hospital systems have decided that they can short staff them. Some of the most vocal proponents of this bill, Senator Nelson sent out a long list. Some of the most vocal proponents are the hospital systems. They're the corporate entities pushing this bill who are causing the problem of short, unsafe staffing in our hospitals. When nurses are responsible for more patients than they can safely handle, when for a situation should call for one nurse for every 2 patients post-surgery or intensive care or whatever, and they're covering 3 or more, those patients suffer. If it's a lower level of care and they should be covering 4 or 5 and they got more than that, those patients suffer. And the nurses are stressed out about it. They're working as hard as they can to protect their patients, even at their own health expense. A lot of the nurses don't even have time to eat. A few years ago, prior to COVID, I talked with a nurse at Fairview Riverside. She articulated the problem clearer than anybody else I've heard. She said she had worked there for 17 years. She said she's always had a trouble with having time to take a lunch break, until recently. She said in the first 16 years there, she had fewer lunch breaks than she had in the last 9 months. Why? What changed? She got a new assignment. She was working in a surgical unit. And apparently, federal law requires a staffing ratio in surgical units, in operating rooms. So you got one requirement, you've got to have a nurse in there. If they're in there for 8 hours a day, the nurse has to have a lunch break. State law at least requires that. And you got this conflicting thing, so the hospitals have to meet the thing, and they substitute, they bring in a nurse so the nurse who's been in there can take a lunch break. So she said she was getting a lunch break every single day. That's the way it ought to be. But talk about nurses who don't. She said that previous to that, and what I think you'll hear from other nurses is, they pack a lunch. They pack a lunch and they be there, but they don't get a chance for it. It's not a rare occurrence. Talk to any hospital nurses. Every one of us has a lot of them in our district. Ask them if they've ever packed a lunch or a meal before going to work. And then they eat their lunch in the car on the way home from work. Tell that story to a nurse. Ask them if they ever heard that. They pack their lunch, they don't have time to do it, to eat it, so they eat it in the car on the way home. Some of us may do that once in a while. They do it routinely. That's not good care for patients when the nurses don't have time to take breaks, when they don't have time for lunch, when they're required, often without advance notice, to do double shifts. That's stress. That's hard work. And when they feel they can't spend time with a patient that needs their attention because they're called to another one and they can't get more staff in the hospital, they're troubled by that. They have problems with it. We would have more nurses if we took care of the ones we have. We have plenty in Minnesota. We just don't have enough in the hospitals. If we want safe patient care, we got to address this. Our hospital systems are ignoring it, and this bill doesn't fix it. I talked to a nurse, an RN in her mid-50s, 2 weeks ago, who told me she was quitting. She retired. She said she still loved nursing, but she couldn't take the stress. She said it used to be she had a feeling that she was really providing good care for patients, but she felt it was not a safe work environment for her patients. She quit because of that. She said she'd love to go back. She'd love to go back if she could have a safe workplace. That's why I think Senator Murphy's bill, whatever it's called, the Nurses at the Bedside Act, that bill would, some people would say, oh, they can't possibly do that. We don't have enough nurses here. Ironically, by taking care of the nurses' needs, more of them are willing to work if they know they're not going to be forced into double shifts, if they're not going to be forced to work through their lunch break over and over every day. This bill, as I said, is pushed by some of the people who are causing the problem, the hospital systems that could address the problem and refuse to address the problem. I want to say that if you look at it, of all these lists of all the people who are supporting the bill, I see one of the handful of letters opposed to it from Elder Voices, family advocates. I got to know them a couple years ago when they were fighting to make sure we had better care in our nursing homes. Their sole purpose, the reason they were founded, was to make sure that elderly people get decent care. They're against this because they think it's going to make the problem worse. The problem with our health quality and safety isn't a lack of nurses. It's decisions made by hospitals that understaff them. They refuse to safely staff, and they're burning out nurses. If we want these nurses to come back, let's provide safe staffing for them. I ask you to reject this bill. This bill does nothing to address that problem, nothing to address the shortage of nurses in Minnesota, because there isn't one. And it does nothing to address the problem that the hospitals could take care of by providing safe staffing. I urge you to reject this bill.
Senator Benson.
Thank you, Mr. President and members, and I would encourage a yes vote on Senate File 2302. Yes, members, we have a nursing shortage in most of our care systems in Minnesota. This bill is not the silver bullet to solve that problem, but this bill is to modernize and update how the practice of nursing happens across our region and across our country. Minnesota nurses should be part of that. They have done heroic actions through the pandemic. We've had nurses come out of retirement. We've had nurses vow to never miss a shift so they can make sure COVID patients are properly cared for. They have been heroic. And there is nothing in this bill that would undermine the gratitude that the people of Minnesota should have for the nurses who stood with our healthcare systems through COVID. And to our healthcare systems, I know you're listening. There are nurses who are hurt deeply by the fact that you pay so much for a traveling nurse without showing them the due respect for all the shifts that they have worked. And so I hope you will mark my words and be attentive to the nurses who stood with you throughout this pandemic. But let me move directly to the bill, Mr. President. We have a national accreditation standard for those institutions that teach nursing in Minnesota. They have to meet a national standard. But if you're an instructor in one of our institutions of higher learning who trains nurses who happen to practice in another state while they're doing their clinical trials or while they're doing their clinical practice, you have to get a license in that state. Our accredited institutions cannot have instructors work in other states without an additional level of licensure. This Nurse Compact solves that problem. Every RN in the state of Minnesota passes a national board. Every RN passes a national board already. This compact does nothing to lower the standard for Minnesota nursing. And let me read you the section of the bill that deals with this directly. If you look on page 4, starting on line 22, a nurse practicing in a party state must comply with the state practice laws of the state in which the client is located. The client is the patient. So if you're a nurse from another state who's working in Minnesota, you have to comply with state practice laws of Minnesota, including all nursing practice as defined by the state practice laws of the party state. That means we still define what it means to practice nursing here in Minnesota. And when you come here to take care of a Minnesotan, or when you tele in to take care of a Minnesotan, you have to meet the standards that we set. The practice of nursing in a party state under multi-state licensure privilege shall subject a nurse to the jurisdiction of our licensing board, our courts, and our laws when a Minnesota patient is located in this state. It does not lower the standards for nursing in Minnesota. It simply makes it easier for nurses from other states to move here. In 2021, in the middle of the pandemic, nearly 5,000 nurses from other states came here and got licensure by endorsement, and they have to practice to our standards. Ladies and gentlemen, this does not lower the standard of care for Minnesota nurses. It makes it easier for Minnesota nurses to work cooperatively with patients in other states. And as we look forward in healthcare, I want you to think about the medical device industry, who's trying to do inpatient clinical trials. A nurse from here checking in with someone in another state would have to be licensed in that state. Even though their doctor can practice here and in another state, the nurse could not. So I want you to think about what that means for the medical device industry here in Minnesota. And we passed pretty comprehensive telehealth reform, telemedicine, as we look at using remote monitoring for chronic health conditions. If you come to Minnesota to have monitoring started, but you go to another state, your doctor can follow your care, but your nurse can't. Can you imagine? Your doctor can follow your care, but the nurse has to be from another state because Minnesota is not part of the Nurse Licensure Compact. And what if your child comes home from college? Say they go to Indiana for college. And they came home, they started some counseling here, and they need a nurse to help monitor medications, et cetera. They go back to Indiana. Their doctor can have communication with them, but their nurse can't unless she goes and gets an additional license. As we look forward in healthcare, the Nurse Licensure Compact allows the practice of nursing to move forward as well. Ladies and gentlemen, I would encourage a yes vote.
Senator Murphy.
Thank you, Mr. President and members. I rise once more in opposition to this piece of legislation. Just a point of clarification. Physicians are in a compact. Many nurses and states are in the Nurse Licensure Compact. The difference is physicians and their compact mean that the physician who wants to practice in a neighboring state has their application for licensure in that state expedited. They become licensed in that state. The Physicians Compact still requires physicians to be licensed in every state in which they practice. The Nurse Licensure Compact does not. So, I, a registered nurse in Minnesota, to reapply for my license once I pass that basic standardized test, the NCLEX, must continue to get 24 hours of continuing education, pursue certification, additional education. A nurse in Arizona, for instance, does not have that same standard. They took that licensure exam when they finished school, that test to say, yep, you're safe to come and enter practice, but they don't have to do any further continuing education. And those nurses would be able to come and practice in Minnesota under the multi-state licensure compact. That does erode our high standards and our high expectations. Just a few years ago, this legislature said that advanced practice nurses must take continuing education in the treatment of people with opioid addiction, because we're dealing with the crisis of opioid addiction. Advanced practice nurses in other states do not have that same standard. We set that standard, and by entering into the compact, we would say, you know what, it's okay. Nurses from other places, you don't have to abide by that standard. We would be lowering our expectations on our high standards for the practice of nursing in Minnesota, foregoing our responsibility as policymakers, giving it over to a national organization that doesn't even have to make its meetings public. I just think that's wrong. But I want to say one more thing about the practice of nursing, because at the heart of that, this is what we're talking about. When I was a new and practicing nurse working in a rural hospital, 50 beds, and I worked overnights, I will never forget this night when I had 3 critically ill patients. There were just 2 nurses for a 50-bed unit. That's a lot of patients for 2 nurses. One person had a cardiac arrest. We needed to code that patient. Another person had come up from the intensive care unit, recently extubated, and he was afraid that he couldn't breathe. Literally afraid that he couldn't breathe. He needed a nursing intervention. And another woman had a GI bleed, and she was actively bleeding in her bed. There were 2 registered nurses on that floor. We called for help, but it took hours for us. It was an extraordinary night that I will never forget. One of those 3 people didn't live. That should be the exception for a nurse practicing in a hospital. But when you listen to nurses now talk about the way that hospitals are staffed, that's the rule. That's their existence, and that's when patients get hurt, when mistakes get made, because there aren't enough people they're prepared to care for the changing status of extra sick patients in our hospitals. And let's be honest, you're not in a hospital anymore unless you're really sick. They need high-quality nursing care in the hospital. That is our fundamental problem. Bringing nurses from other places, and I would say the compact is going to exacerbate traveling nurses. We were going to have more traveling nurses here, and we're going to pay high dollars for them, $250 an hour, instead of working to retain our nurses in our hospitals. That's ridiculous. The American Foundation of Nurses just did a survey, just came out March 1st, 2022. Nurses from across the country in this survey. 89% of nurses surveyed said their organization is currently experiencing a nursing shortage. 89% say their organization is currently experiencing shortage. That's across the state. Even though we know there are more licensed nurses, they're experiencing a shortage in their workplace. More importantly, the survey says that the inability to deliver quality care consistently is now the top reason that nurses are intending to leave the practice of nursing in our hospitals. We have a problem, but this is not a fix to that problem. And if you're not concerned about what the nurses are telling us, then let's pay attention to the letter on our desks from Elder Voice. This well-intended proposal increases the risk of serious harm to long-term care residents who are dependent on well-educated and qualified RNs and LPNs. If you're not going to vote for the nurses today, you should be voting for Minnesotans who are getting care in our facilities. This is a mistake. Members, vote no.
Senator Gazelka.
Thank you, Mr. President. Members, I'll keep my comments brief, but we have a workforce shortage and we don't have enough nurses, and nurses are crying out for more help. Very grateful for the work that they do. They are the healing hands to many people in the work that they do. I have a daughter-in-law that's a nurse. I have nieces that are nurses, and they would say that they're overworked and that we need more help. This is simple. The Nurses Compact allows the ability for more people to come and become nurses in Minnesota that are already nurses. And we learned from the pandemic when we had thousands of people come and help us, we didn't have any problems. We had good nurses come from all kinds of places, and this makes it easier to alleviate the workforce shortage for nurses and give our patients better care. This is a green vote. Thank you.
Senator Newman.
Mr. President, there is on our desks a number of letters from both pro and con on this particular bill. I just wanted to relate to you, Mr. President, that this morning I contacted my local hospital. And as I often do when it comes to controversial bills that are on the Senate floor, I like to go home and talk to the people who sent me here. And so I called my local hospital this morning. And I will tell you that I'm going to support this bill because they support this bill. And what my local hospital in Hutchinson told me today is that this is a very good idea to help that hospital run more efficiently. They told me that this compact is available. They told me it's in 33 states. I don't know if they've got the exact number right, but it's in a lot of different states. They told me that when there's a national disaster, a storm of some kind, where nurses have to cross state lines, that it really helps if they are, the state is a member of this compact, because when they need nurses, they need them right now. They can't wait to go through a long licensure practice. They also told me that the training and technical expertise of the nurses is very comparable to what is required in the state of Minnesota. And then they also mentioned the fact that, the legislature a couple of years ago, we passed a compact similar to this for doctors and psychologists. So what's different about nurses? How come there is this opposition? So I'm going to vote green on this bill, Mr. President, I'm going to support it, and I'm going to do so because my local constituents, the folks that I listen to the most, they are in favor of this and they want this passed. Thank you, Mr. President.
Further discussion to Senate File 2302. Senator Lopez Franzen.
Thank you, Mr. President, and thank you for the civil discourse here today to talk about a really important issue, the state of our health, the people of Minnesota, keeping us going post-pandemic. And I'll start by saying thank you to every single nurse in every corner of our state that has gone above and beyond, not just in the last 2 years, but always. Because members, this issue isn't new. I've been here almost 10 years, and since I started my work in Health and Human Services, I've heard from nurses and what they want and what they need and what they do for us on a daily basis in our hospitals, in our clinics, in our schools, in our workplaces. And we still haven't answered that call to action. And this bill, members, is not the solution. We've heard it on finance described as a Band-Aid. A Band-Aid. That's what we're going to do to help our nurses. That's what we're going to do to help Minnesotans, is provide a Band-Aid solution. Mr. President, the debate today we're having is not simply an argument about which set of rules our nurses are going to be under to deliver high-quality care in Minnesotans, which Minnesotans have come to expect. And we all know that high standards of Minnesota nurses expect of themselves. That has never been in question. Rather, today's debate is truly about each and every Minnesotan who has accessed our healthcare system and whether we will compromise patient safety with our actions on this bill today. We have come through 2 tough years, and we're all worn out. It's upended the lives of Minnesotans, businesses, schools, and the people who have fed us and kept us healthy. But I would argue few have faced as much adversity and exhaustion and disruption as our healthcare workers, our nurses being at the forefront, who as we speak continue to be exhausted and working so hard to keep us healthy. Nurses have stepped up and put their own health and safety at risk because of all of us. And they're committed to delivering high care, high quality care, despite those dangers and adversity. Members, these folks didn't have a vaccine and were at work with less than adequate PPE. And here we are, instead of appreciative, we're doing something that actually might put their work and their health and safety at risk. For 2 years, nurses have worked in conditions that at times have resembled war zones. Many of you remember those pictures from New York City and New York. That wasn't that long ago. In that time, they have often come to work and found that they have to work a double shift to ensure Minnesotans get the care they need. And today, still today, they're struggling with protective equipment. Why? Because I've talked to them. They're exhausted. Many are considering leaving the profession and have a profession that they love at the very time that Minnesotans need them the most. The issue today, Minnesotans, is whether we will continue to have nurses practicing at the high standards that we all expect them to practice and whether we will deal with the issues that are driving them away from the profession, and whether we are compromising patient safety. As colleagues of mine have mentioned already, this bill does nothing to address the root of the problem. First, you heard today this bill weakens and disregards the standards that we as a state put in place to have high-quality nurses to keep patients safe. We Minnesotans, legislators, boards of nursing, the bodies in power and will to make sure that we keep the practicing of nursing safe for all of us. Under this bill, nurses in this compact would not need to meet Minnesota's continuing education standards or other qualifications this state may enact in the future. That's just the fact. And don't be fooled that it does. We can't even amend the bill to make sure that nurses coming out to our state to provide care to Minnesota families will meet our state's standards. They're going to be abdicated our duties to a national organization that has minimum thresholds for patient care. Minnesotans expect more. That's why we have a board of nursing. That's why we license them. That's why we have extra criteria for them to meet. And that's why we are one of the best states in the country for health care. Our nurses help us achieve that each and every day. We're giving our duties and oversight to a non-governmental body to be in charge of oversight and setting qualifications required for nurses within a multi-state license. That scares me. In short, we're undermining what we as a state have put in place to regulate nurses who practice in our state. This bill will not help retain nurses. In fact, it will do the opposite. It doesn't solve the issues that lead to the burnout that nurses are experiencing. And in fact, it could exacerbate staffing shortages. We need to listen to the reasons that nurses are leaving, and we ignore them at our peril. We know the prolonged stress of COVID-19 has pushed some into early retirement or out of the healthcare workforce altogether. Some aren't even contemplating it to begin with. Instead of bringing out-of-state workers to solve a crisis, we should be focusing on solutions that invest in Minnesota nurses and emphasize the state's high standards for patient care. Take up our Nurses at the Bedside bill. I'm a proud co-sponsor of that legislation. We tackle all those issues comprehensively. States across the country, including those in this compact, are facing shortages. We all are after a national, international, global pandemic. This bill will incentivize more bedside nurses to become travel nurses, but it will not improve Minnesota's staffing shortages or improve care for our patients. Again, Senate Democrats have comprehensive bills to support Minnesota nurses by giving them more input in staffing decisions and increasing workplace safety. Our measures also give nurses long-term supports around mental health, loan forgiveness, more financial aid for students looking to enter the nursing field to begin with. And these are comprehensive solutions that nurses have vouched for to improve retention. They're not new solutions. We just choose to ignore them. So, Mr. President and colleagues, this bill falls short of what we need to keep Minnesotans and nurses on the job to keep the high standards of nursing that we all have come to expect, and most importantly, to ensure the safety of our patients across our state. I'm a licensed attorney. I passed the bar in the Minnesota licensing. I cannot practice in any other state but Minnesota. And that's due to the nuances of state law and how we practice law in this state. I'm not dealing with people's personal health on a daily basis, but passing this bill is going to lower the bar, not for attorneys, but for nurses. There's no question. Attorneys will have a higher standard of practice because we'll continue to oversight and have that oversight on our state. But we're removing the oversight from our state when it comes to nurses practicing nursing. That is simply unconscionable. Please vote no. Thank you.
For closing comments, author of the bill, Senator Nelson.
Well, thank you, Mr. President. Well, I do appreciate the lively discussion today. I do think it's important that the facts be restated just to make sure that the public and members are aware of actual facts. First, I want to refute this idea about regulatory authority being shifted to the federal government. That is not true. That is not true. The Minnesota Board of Nursing will retain authority and registration. There was also a comment that we won't know what nurses are practicing here. That is not true. The Minnesota Board of Nursing will continue to have all of that information. I also want to speak to the Board of Nursing for a moment. I would not want anyone to have impugned the Board of Nursing in their survey. That is a neutral organization, a credible survey from a neutral organization. And I would note that in addition, there was some talk about corporate interests, and I would encourage members to look at the 59 supporters who know that it will benefit Minnesota nurses and patients to become part of the Nurse Licensure Compact. Hazelton isn't a corporate entity. The University Minnesota of Nursing is not a corporate entity. If you read the dean's letter, you would have seen how important it is that our nursing instructors who are building the pipeline of nurses so that we don't have such a shortage actually are able to get the training that is needed from instructors rather than having an instructor licensed in every single state. The National Patient Safety Foundation supports this legislation. This is not a corporation. 80% members of Minnesota nurses surveyed support becoming part of the Nurse Licensure Compact. And let's be clear, everyone in this body, every Minnesotan supports nurses. We all know how important nurses are to continuity of care, to the quality of care. They are the link that we need. It is the nurses that are so important to care. And this bill supports Minnesota nurses, and the nurses support this. Now, there is one organization that you've heard from today that does not support this bill, and that is the Minnesota Nurses Association, who, by the way, has less than 1/6 the number of licensed nurses as a member. Yes, this membership organization does not support. But why do we not listen to the majority of nurses who have said, we want to be part of the successful Nurse Licensure Compact that has been operating in 39 other states and jurisdictions, has a history of over 20 years, and we have allowed other compacts for professionals, but oh no, we do not want to allow Minnesota's nurses the advantage of keeping up with their peers in being part of the Nurse Licensure Compact. And I also thought I heard something about safety. Let's just set that aside. That is a red herring. Minnesota nurses are trained to the highest standards. They must pass the National Nurse Licensure Board exam. And be sure, members, that Minnesota retains control and authority over the nurses' requirements in our state. So members, when you look at the facts and you look at the people about whom this this nurse licensure compact will help the nurses who want it to be competitive with their fellow nurses in other states, the nurse educators who want it so they can continue and build the pipeline that is so needed, and the patients who want the continuity of care from their nurses. When they come to Minnesota and they get excellent health care and they go back home, whether it be with a medical device or whether it be through Zoom or telehealth, they want to keep their excellent Minnesota nurses. Members, I ask that you think about patients, nurses, and I ask that you vote green, and let's remove Minnesota from its 100-year-old licensing system. Let us get into the new century, which is supported by the regulatory boards. I urge a green vote.
The Secretary will take the roll on Senate File 2302.
Mr. President.
Senator Jasinski.
Senator Jasinski votes aye.
Jasinski votes aye. I call on Senator Frentz to report members voting under Rule 40.7. Senator Frentz.
Thank you very much, Mr. President. Senator Fateh votes no.
Fateh votes no. I call on Senator Johnson to report members voting under Rule 40.7. Senator Johnson.
Thank you, Mr. President. Senator Lang is an aye.
Lang votes aye. Senator Johnson.
Senator Draheim is an aye.
Draheim votes aye. Senator Johnson.
Mr. President, Senator Tomassoni is a no.
Tomassoni, no. Secretary will close the roll. There being 35 ayes and 32 nays, Senate File 2302 does pass and is title agreed to. Remaining under motions and resolutions, Senator Westrom.
Mr. President, I forget the Senate file number, but I move to refer the motion that you have at the desk from the Jobs and Economic Growth Policy and Finance Committee to the Agriculture, Rural Development Policy and Finance Committee.
I'll help you out. Senator Westrom moves that Senate File 3617 be withdrawn from the Committee on Jobs and Economic Growth, Finance and Policy and re-referred to the Committee on Agriculture and Rural Development, Finance and Policy. Senator Westrom, that is your bill, and you have discussed this with both of the chairs?
Mr. Chair, we have, and it's a rural broadband federal funding policy bill that got referred to the Jobs Committee instead of the Agriculture Committee. So, thank you.
To that motion, all those in favor signify by saying aye. Those opposed, motion does prevail. Okay. Moving to the 13th order of business, announcement of Senate interest. Without objection, the following senators will be excused from today's session. Senator Westrom from 11 to 11:20, Senator Dietzig from 11 to 11:20. Announcements. Senator Herr.
Thank you, Mr. President. As a member of Minnesota Asian Pacific Caucus member, I'd like to inform our fellow senators and madams, senators that today is Asian Minnesotan Day at the Capitol, and you'll receive visit from community members advocating for their needs in support of economic development, anti-Asian hate, and education for youth, immigration, and veterans, and so forth. So expected a visit, and also it's an all-day activity, and also there will be a virtual closing at 4:30 today. So just want folks to be aware. I passed out the flyer to your desk already. Thank you very much.
Senator Kunish.
Thank you, Mr. President. I would just like to remind everybody that tomorrow is International Women's Day, March 8th, and it is a global event celebrated around the world, focusing on the social, economic, and cultural and political achievements of women. The day is marked as a call to action for accelerating gender parity, and I want to do a shout out to all of the women in this room that are leaders in their own ways. This day has been occurring for over 100 years, and the path to women's equality has been long and challenging, and there's reasons why. But each stage provided an important focus on forging the gender agenda further along. We believe that women's rights are human rights, and everyone in this room and everyone around us has that responsibility to create a society in which women, be they Native or Latinx, Asian or Black, disabled, those living in poverty, immigrants, Christian, Muslim, Jews, queer and trans women, any combination of these are free and able to care for and nurture their families, however they are formed, in safe and healthy environments, free from barriers. So I would like you all to remember this tomorrow as we celebrate International Women's Day. Think of those women that have made change, positive change for each and every one of us. Thank you.
Senator Coran.
Thank you, Mr. President. Just a reminder, everybody in the Civility Caucus is hosting a luncheon on Thursday, March 10th at 12 p.m., 2412 in the MSB. There may be a conflict with session. Stay tuned for updates. Thank you.
Senator Miller.
Thank you, Mr. President. I move that the Senate do now adjourn until Wednesday, March 9th at 12:15 p.m.
To that motion, all those in favor signify by saying aye. Those opposed, the motion does prevail. The Senate is adjourned.